Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and welcome to my third HPUPM patient blood management series. And this video will discuss a little bit about definitions of anemia. I think most of you have understood about anemia, how it is quite strongly related to the problems of red blood cell. If you have loss of RBC, it causes anemia. When you have lysis of destruction of RBC, you can also have anemia. And of course, when there is poor RBC production, especially from the bone marrow, it can also result in anemia. But have you ever wondered that anemia itself can cause the loss of RBCs because of a poor blood clots to maintain the hemostasis? And due to anemia itself, some of the RBCs can be lysed because of poor oxygenation of the red cells to survive within the circulatory system, and anemia can also cause bone marrow suppression, as poor in RBC production. Now, anemia has been a word from the Greek methodology, and it is basically means without blood. And if you look at the proper definitions of multiple textbooks that we use during undergraduates and even now, you can see, amazingly, you can see the expansion of the anemia definition. Just for example, the textbook in Essential Hematology, for which we always ask our undergraduate students to read on, it is defined as reduction in the hemoglobin concentration of the blood. A very simple understanding. In Harrison's Principles of Internal Medicine, which is the Bible for general medicine physician, it is further expanded into a significant reduction of red cell mass and a corresponding decrease in the oxygen carrying capacity of the blood. But my favorite is actually the Grucci's Clinical Hematology in Medical Practice, where it is further expanded into the philosophy of anemia and its dynamics, whereby it is defined when the hemoglobin level is below the extreme of normal range for the age and sex of the individual, and at some point through the population. And the lower limit of normality is acceptable as to be reduced in pregnancy. So here you find a very rounded philosophical definition of anemia in the Grucci's Clinical Hematology. So our difference in understanding sometimes also depends on which textbook we read. But the WHO criteria, or which are our reference, worldwide or global reference, put even in a objective and simpler definition, whereby anemia is defined in men when the hemoglobin is less than 13 grams per deciliter or hematocrit less than 40%, and in women, hemoglobin less than 12 grams per deciliter. What I'm trying to point out here, HB of 10 is anemic, regardless of gender, regardless of age, or the particular population. Now, what is the magnitude of the problem in Malaysia? So I was trying to look through some old articles that has been produced or published by our own local authors and researchers. And it's quite interesting that in 2004, iron deficiency anemia is commonly found in non-pregnant female adolescents in Sabah. And this is a very good article for you to read. And further, I found a paper in 2007 whereby anemia in pregnancy in Malaysia was found to have a prevalence of 35%, which is quite high, meaning that 1/3 of our pregnant ladies are having anemia. And there was another paper on antenatal mother in urban Malaysia in the 3 Selangor polyclinics. And this surprisingly shows prevalence of anemia amongst these antenatal mothers are around 33%, not far from the research before. So I did my own assessment of the patients in Sedang Hospital, anemia in pregnancy in Sedang Hospital, and how common is the problem at the first contact, meaning the first visit of antenatal care follow-up. And surprisingly, in 2013, with permission of our CRC of Sedang Hospital, we were able to find that the prevalence is much significantly higher, around 44%. What are the causes for the anemia within this anemic pregnancy Sedang Hospital was not being able to look into in detail because this was just a cross-sectional study. And in 2017, there was another paper that shows the prevalence of anemia was around 35.3% in elderly patients. And this is quite significant and worrying because it is seemingly anemia conditions is quite a serious problem in Malaysian population. And recently, I've also made another cross-sectional study to look at the prevalence of anemia in 2016 in the General Medical Wards Hospital Sedang. Again, this is by permission of CRC Sedang Hospital. And strikingly, we found that 59.7% of patients admitted to General Medical Ward of Sedang was in the is defined as having anemia. In 2017, I did explain about deworming, the importance of deworming in our population, which has always been disregarded. And in fact, if you try to remember when was the last time you took a Zental or deworm medications, I'm sure most of you would say when I was very small. And it is incidentally, after this article was published, WHO also set up a recommendations within 2017 as well, and they guided themselves through with the preventive chemotherapy to control soil and transmitted helminth infections in at-risk group population groups. And the recommendations were to deworm patients in scheduled manner in children, non-pregnant adolescent girls, and women of reproductive age, and definitely in pregnant women. So these are the updates of and few local research, and in conclusion, anemia is very significantly prevalent in Malaysian population, and for now, I think we should treat or we should manage anemia very diligently in order for us to get to the point of etiology and treat them well. With that, thank you for your attention. I'll see you in the next video. Assalamualaikum warahmatullahi wabarakatuh.